My name is John Cox. If you don't know me, I'm from way up here in northern Michigan, in Onaway, up here between nowhere and nowhere. And but technology still works. But I about 4 years ago was pretty sick, and I've seen 13 endocrinologists in a 20-year time frame trying to get my diabetes under control, and it just seemed like the more medication that I got on, the more weight I gained and the worse that I felt. And when I was young, on my 13th birthday, my dad had triple bypass surgery, went way wrong. So it was always in the back of my head that um, I didn't want to have my life end up the way his did, because I watched him once he got wore down from the medications, from all the really, it was terrible insulin resistance. Looking back at it now, I know. I mean, I know this, and I was very skeptical about what you're going to see tonight. But when I finally uh, checked my pride at the door and truly looked at this, it radically changed my life with my health and so many people. And it's the most wholesome thing I've ever been part of. And this was around the last 18 years of my dying father's life. And if we would have known about it, not one other person, my friend invited me about this program, this protocol. I've never been reached out to anybody else in the last 3.5 years. So the person that may be inviting you on this call thought enough of you, and they're really trying to save your life. They're trying to save a loved one's life. They're trying to prevent somebody from having a lot of the medical problems that so many of us were dealing with. And a lot of the medical professionals that are going to talk tonight have struggled to try to figure out how to really just get rid of the root cause. So Diane and I are going to quickly walk through. I'm going to share my screen. All right, Diane, can you see the screen?
Yes, I can. Yes, I can.
All right. So insulin resistance is the leaky pipe behind your wall that you don't see. It's that leaky pipe in the basement that is there. It's dripping a drip at a time, and it's doing a lot of damage. And there's so many symptoms of insulin resistance, but I thought it was just part of getting older. I mean, some of the symptoms of insulin resistance are things like skin tags on your neck. Maybe your side armpit area. Well, insulin, when I injected shots for 20 years, I gained 80 pounds in 5 years. My body was already really high with swimming in insulin, and then I was injecting more. And that made me physically grow everywhere. But another sign is those skin tags, they'll just pop up. It's your skin being insulin resistant. Maybe that dark pigmentation around the neck. PCOS in women. I was just doing a bunch of research today because I'm nerdy about it now, and I love to do that. And there's so many cases of PCOS now in our country that it actually equals the population of New York City. Let that sink in. I mean, there's 10 million people. Erectile dysfunction in men, fatty liver disease. I mean, almost half our country now is dealing with the non-alcoholic fatty liver. About 10% of all of our children and 20% of 5-year-olds are dealing with a disease that alcoholics used to deal with, quite frankly, in 1970. If you have arthritis and inflammation, that's not just a part of getting old. If you're constantly tired after eating, if you're craving salty, sugary foods, and you're hungry all the time, I mean, I literally would eat a meal, an hour later, I was hungry again. Or I'd eat supper and I'd be thinking about the leftovers in the fridge. I'm sure no one else has done that. And then we've got a couple of gut health specialists on the call tonight, but then they're going to really hit why anxiety is so tied to the gut for depression and migraines and leaky gut and causing brain fog. And then type 2 diabetes or type 3 diabetes, Alzheimer's, which is sugar on the brain. And there's also medications that isn't helping that cause. And then just that inability to lose weight. I don't know if you've been there, but I thought where a period of time in my life where I could look at water and gain weight, right? And we're not talking about the jiggly fat that we can pinch. None of us like that, to look at that. I'm talking that between your muscle lining in your organs and around your organs, that visceral fat is one of the most dangerous things in our body. And we might touch on some of that tonight. And then heart disease and stroke. Why is it still the number one cause of death in our country, followed closely by cancer? So Diane, I mean, me and you, we definitely don't have a medical background. However, we've got quite an education. Would you
Yeah.
walk everybody through, how are we getting sick, and why? And really, it's because of a couple things. But would you walk through this slide real quick, please?
Absolutely. Absolutely, I will. As you can see, the slide actually says the modern diet dilemma. That would be the standard American diet. And if you look at the initials, standard American diet, it says SAD. And that's exactly what our diet is. We eat a lot of ultra processed foods. I was just doing a little bit of homework too, and found out that some of the companies that were using pure avocado oil have just recently been sold to Kraft, and they're no longer using the real deal. So we have it coming from all sides. Our foods are, for the most part, ultra processed. Along with that, we have been under the impression, I'm going to say taught, that we should be eating frequently throughout the day, that that's going to somehow keep our metabolism running properly. And that's what I believed for years. I thought the smartest thing I could do was eat a little something every couple hours. So as you can see here, this is really a representation of the way that most of us eat. It's breakfast, and many people say to me, "Oh, I don't eat breakfast," but the truth be told, a flavored coffee is breakfast, is causing a sugar spike. So as we graze our way through the day, even with things that we consider healthy snacks, what we don't realize is that we are causing blood sugar spikes and crashes. This is where the problem comes in. We're led to believe that if I just have one cookie and it's only 80 calories, somehow that's okay. That cookie still converts to glucose in your bloodstream. And when sugar or the glucose goes up, as you can see on the chart, the blue line, every time that we have a spike, insulin is released from our pancreas. I never knew this. I knew that sugar could be a problem, but I never understood. John, I thought that insulin was exactly what you had said, a shot that someone
Yep.
took. When I understood that my pancreas secretes insulin every time glucose is present, it was a game changer for me, because I learned that while sugar goes up and down very quickly, that's what causes that mid-afternoon slump, that time when I just wanted to lay down and take a nap in the afternoon. I blamed it on getting older, and it had very little to do with my age. It had everything to do with the blood sugar spiking and crashing. But again, if you look at this list, you look at the graph, you're going to see the purple line is insulin. Insulin's job is to remove the glucose from your bloodstream and get it into your cells. But because we are overworking insulin, he's kind of like a factory worker that they have on 3 shifts and they're never giving him a break. That's what we're doing to our insulin. It can only work full time for so long, and it has to have a break. So insulin is working overtime, trying to remove the glucose, get it into our cells. And there comes a point when our cells simply say, no more. And that is insulin resistance. Now insulin has another job. It has to do something with the glucose. It turns it to fat, and it stores it away. That's where the problems come in. Another piece of our problem with our American diet is that we don't have fiber in our foods anymore. And John, you have a couple examples here. One is an apple. Everything in nature is wrapped in fiber. That apple, when you peel it and process it, you have a glass of apple juice or sugar water. When you have the peel on it, the fiber helps to slow down the absorption of the glucose. This is, to me, absolute evidence that God knows what he's doing. You look at the rice, and then it's stripped of its fiber, And now you have another bowl of sugar. The same thing with wheat. Even sugar itself is wrapped in cane, it's wrapped in fiber. So when the fiber is stripped, and I know that the other folks will get into what actually happens it, but when you're constantly eating, you strip the fiber from the food, you're going to have blood sugar spikes all day long, your fat storage, low energy, and then it says here too, long-term disease risk. And many of the things that we're dealing with today, the chronic health issues that people are dealing with, are actually lifestyle related, and this is it right here.
Awesome job. Thank you so much. I know we went through that quick. Diane
I
actually is
know.
an expert at this, but we've got some other folks we
Yes,
can't
we
wait to
do.
hear from.
Yes.
So, if you look at, when did this happen? Well, on those graphs on the right, you can see 1970, and these are updated today. I pulled all these graphs and data
Mhm.
today because I wanted to have recent. And about 1980, why are we getting sick? That is exactly when the food pyramid started to change. And if you look over here
Mhm.
on the left, that's where we started to say they started to recommend load your day with lots of ultra refined processed foods and carbohydrates. And what used to be the foundation, which was meat and dairy, used to be the foundation, and now it is again because they've redone this. But look at
Yeah.
what's happened to obesity. 1980, about 15%. Now, look what's going on. And why did it happen? The food changed. Diabetes type 2, look at 1.3% of the population, and I didn't even include pre-diabetes on here. I should. Look what it's done, and right here is exactly when they modified that food pyramid and that recommendation. So there's two products. I'm not going to get into the details on this because we got experts on here, but it's a
Mhm.
fiber and a fasting protocol. And fiber is being stripped of our food, like what Diane said. We're adding it back in, but it's not just Metamucil or Benefiber. It is a
Mhm.
patented blend. I'm going to let our experts on the call really discuss why this is so good. The intermittent fasting. We know that fasting is good for us. We've been doing it biblically since the beginning of time. It's
Yeah.
very hard. Most of us have all heard GLP-1 this. Now they have GLP-1 pills you can take and lots of side effects. Bottom line is people are desperate to bring their blood sugar into control, to lose body weight. Our body knows how to make GLP-1. It was designed perfectly, and then men and women have been screwing it up by the way that we eat. This is a tool we use to make intermittent fasting a lot easier. And Diane, if you could just quickly walk through, because a lot of people are invited on this call.
Yes.
How do they get it? Here, a lot of the proof. I mean, we're going to hear that, but really quickly, how does it work and how do they get it? And I know we went through a lot quick, but we want to get to
Okay.
our
Well,
experts.
we're going to very intentionally, we're putting the cart before the horse tonight, but I think it'll give people a good idea. We actually have a protocol that we implement, a couple different products, and then we will be talking about that. One of them is a yerba mate extract. We just simply drink that whenever we're not eating, and it helps to reduce food noise. It increases our GLP-1. The other piece of it is the fiber, as you were talking about, John, and that fiber is a patented blend. This, I believe, is what is so important, and what really sold us on this is the fact that for $159 a month or $5 a day, we are able to not only achieve the best health we've ever had, but we have clinical studies and patents that are on these products. It's 100% natural, which makes us feel really good. Cost neutral in the sense that we're no longer snacking, we're no longer grazing. In fact, we bypass breakfast and just eat 2 meals a day. But if you're old enough to remember, you will recognize Rexall Drugstore, and they are originally the pharmacy that developed this protocol. It's been studied by Cleveland Clinic, University of Sydney, BYU. These are just Stanford. These are just a small sampling of the studies that have been done on this product. And I don't think it's listed on here unless it's in the small print somewhere. But excuse me, these products are actually listed in your physician's desk reference. So you can go to your doctor with full confidence and let them know that they can look it up right next to all of their pharmaceutical drugs. There's 100% natural nutraceutical here. So again, you can see through the bottom, we bypass breakfast. We drink the tea whenever we're not eating. We eat lunch. We drink another tea. We have the balance before our dinner. It has been for me the absolutely easiest thing I've ever done.
Yeah, absolutely. Well, folks, that was probably the quickest Diane and I
Ooh,
have ever
yeah.
walked through this, but it's because we are in for a really big treat. And we got some, I'm going to stop sharing my screen. And wow, we got 32 people onto this call. Well, if you have people that you're thinking about, that you care about, that you want to make sure are here for the next family reunion, the next
Mhm.
class reunion, to see that next birthday, or to just go through the last 10, 15 years. I mean, you can add decades to our life if we start to fix ourselves from the inside out, and it's really a natural solution. So, the first one I'd like to ask a question to would be Dr. Travis Robbins. Dr. Travis, can you come off mute, please?
Hey, John.
Hey, buddy. Well, so Travis and I have known each other for a long time. And when I started to get much improved health, Travis was on that list of people that he's just the kindest person I've ever met. I have to really work hard to be as nice as what Travis naturally is. I mean, professional athlete, Division I, went to the Army, very successful there, and now he is very successful at one of the VA medical clinics down in South Carolina. So, Travis, welcome. Thank you so much for being on here tonight.
Hey, thanks for having me, and you give me way too much credit.
No, not at all. But I guess so. You had a long military career. So, and we had talked earlier, but what's changed? I mean, I almost didn't call you because what am I going to teach a doctor, let alone a college athlete? I wasn't good enough to do that. But yet I had no idea you were struggling with a lot of the same things. And I think it was, I remember you said how eye-opening it was when you had been really digging into the research prior to this on inflammation and why metabolic syndrome. Walk us through what was so with this product. It's so simple, but it's been life changing for you and your wife. But what was the most eye opening thing that you had been looking for a long time?
Well, I think you nailed it, John. I had spent my career playing high school, college, and then going into the military as a physical therapist. I spent my career trying to understand performance. And with that, we knew about diet, exercise, sleep, the spiritual aspects of performance. And it all made sense when you had high achieving soldiers or athletes. They were on autopilot. They would work out, they would eat, they would perform. But then when fast forward into the army, I would see soldiers, sailors, airmen, Marines come into my clinic. And many of them were struggling with anxiety. I know we'll talk about that later. They would struggle with their weight. They would struggle with low energy and all of those things that come along with it. And I thought it was inflammation. So when I was going through my medical training, everything was built around inflammation. You sprain your ankle, you strain your back, you have a tendonitis, a arthritis. The itis indicated the inflammation. And so I thought, Travis is a smart guy. Inflammation is the driver. And I think for a big part, that was partially true. But when you look at behind the scene, what was driving some of the chronic inflammation was insulin resistance. And that was the game changer when you called me. So I'd been studying this for 20 years. And when you called me, I was humbled because I had never thought about insulin resistance as a driver of inflammation and weight gain and all of those other conditions that go with it. I was seeing soldiers, female soldiers with PCOS, but I wasn't putting it together with insulin resistance. I was seeing soldiers with chronically high blood pressure, and I wasn't able to put some of those pieces together. So I was so thankful when you called because I think one of the myths I want to dispel is I think two myths. One is that medical providers are somehow set aside because of the knowledge we have in our head, and we're these ultra healthy, know-it-all individuals. Well, the truth is we may have a lot of information in our head. Some of that is very antiquated information, and some of it we will learn with science is wrong. And I think I was dealing with some of those conflicts. I myself was getting more overweight. I had chronic inflammation myself. Now my blood glucose and some of my numbers still were good. And I think we can talk about how long it takes for insulin resistance to come on. But I was, in some respects, a ticking time bomb. And I just didn't realize it. So as a healthcare professional, I had a lot of information in my head, but I wasn't prepared to put the pieces together when it comes to insulin resistance and those chronic conditions. And the other myth is that your healthcare provider is going to know it all. Medicine is too diverse for any one person to know it all. And I feel like every day I'm learning more about how the body works. And your call was actually a life-changing event for me and my wife.
Sorry, I muted myself. So, Scott, if you could come, Scott Harther, so Scott not only super e- uh, successful in the corporate world. I mean, Scott is an executive for Cummins, 30-year career. I mean, this guy is he's so busy, and for him to take time out of his schedule tonight to help us, but also became a certified gut health specialist because of his own problems that he was facing. And so, Scott, if you could, I see you're off mute. Welcome. Thank you so much for coming on tonight.
Yeah, thank you, John.
Yeah.
Yeah, just go ahead.
No, I was just going to say, I mean, so you not only successful in corporate America, what's really neat is you take your problem solving skills in corporate America, and I'm used to those kind of skills, and I see you apply them all over, and you did on your own body because you weren't well, but mental health has escalated over the last 30 years, and I would have no idea how much a healthy gut or a very unhealthy gut has led to the anxiety and depression epidemic, and even in younger and younger children. So if you could hit on that and how these products really help fix that.
Yeah, sure, John. Yeah, that's first. Thank you for the introduction, and it's humbling. I've by trade I'm an engineer, but just a little bit kind of background. Several years ago, I got ulcerative colitis, and I could not find a solution for my doctors couldn't find a solution. So that's how I got into this. My father had died of colon cancer. I was having a lot of trouble, so I went to study gut and metabolic health and to come up with a protocol to help my gut. But saying that, I was struggling still with my ulcerative colitis some and weight gain that I couldn't get rid of. And coming along with this protocol really helped me understand what's going on with insulin resistance and studying this over the last year and a half and really understanding how it's impacting. And John, your question about mental health hits home, not for both my wife and I. With ulcerative colitis, a lot of times you have a lot of anxiety tied with the pain. And my wife, and I won't get into a whole lot of details about that. She's not on here tonight, but I know she wouldn't mind me sharing. But with her, prior to using the protocol, and I want to be careful tonight because I don't saying that this will cure depression, but she is no longer on her medicines for depression and anxiety that she was on for over 30 years, right? And so this is one of the most fascinating things about how gut health and is tied to this. And I just want to give a little bit of background for the folks to understand what's really going on with our bodies in relationship to gut and the brain. We have this thing called this gut-brain axis, and more specifically, a microbiome gut-brain axis. And most people understand it kind of like I was talking about early in one direction. You get nervous, you feel the butterflies, right? We've all felt those when we've done that, and we get stressed and your digestion changes. But the communication for us goes both ways in our body. And it goes toward the brain as well. And that communication involves the nervous system, the immune system, hormones, microbiome, and compounds. And we could talk about that for an hour, right? But when the gut microbiome gets out of balance, we call that dysbiosis. And that's really a big word for saying that we just got more bad bacteria than good bacteria, and those signals get messed up and when our environment is not good in our gut. And dysbiosis can influence immune signaling, inflammation, some of the things that probably Dr. Travis will talk about, which intestinal permeability, which is big for us, right? Stress response pathways and a whole host of other things. And those pathways are connected with neurotransmitters involving in the mood, including serotonin signaling and dopamine signaling. And I call those our happy hormones. Now, I know that isn't what a PhD would really call them, but that's how I can relate them to how we feel. And that's one reason researchers are so interested in the relationship between the microbiome, depression, anxiety, and mental health. Now, I wouldn't say that dysbiosis causes depression, but depression, anxiety, and those things I'm talking about tonight and they're very complex, but they are highly impacted by the gut. And so your gut doesn't just control your mind, but it participates in this biological conversation that influences our whole person. And that kind of brings me to this product or the protocol that Diane and John were talking about into fiber. And I'll just go into it really quickly if I got time, John, about another minute here. But our microbiome, it eats too, okay? Certain fibers reach the colon. Microbiomes, they ferment. And those microbiomes, they produce short chain fatty acids. And those compounds participate in the gut barrier function, immune signaling, metabolic signaling, and a broader gut-brain conversation that we have. And that's one reason I like the fiber conversation about the balance that John and Diane were talking about. Balance gives us that fiber, and fiber helps create a nutritional environment for our gut. You know, our gut just isn't about digestion, right? It's about all these other things. And like I said, I would never say that, like, for example, balance treats depression, right? But it directly it can raise our serotonin and our dopamine. And so balance doesn't just treat the depression, but it helps us feed our ecosystem and participate in the gut, I would say our gut conversation, and helps us start to heal from the inside out. And there's also some other effects of Unamate, John, if you want me to go in those, but that also helps us as well in terms of the signaling that happens in our bodies and whether we feel hungry or not and whatnot. So, and blocking those signals. So mental health doesn't, exist separately from sleep, stress, appetite, energy, nutrition. They're really an interactive system, and having a healthy gut plays so much. And I'm telling you, once my gut started healing, my anxiety went away. My wife's depression has just went completely away once she started to heal that gut. And the fiber is so important to that. So that's you can tell I'm passionate about it. I could go on for an hour about it.
Yeah, and we definitely will. We definitely will in a future time. So, Scott, we're going to come back to you, and Diane's going to introduce the next couple speakers.
All right. All right. This is so exciting. I love listening to what Scott was just sharing, and I have just been doing a little bit deeper dive on that because I was one of those, 30-year plus people on the medications as well, and it's nice to understand why I feel so amazing and don't need them anymore. So, all right, let's move on. I would like to introduce one of my dearest friends on the planet. I feel very fortunate. I tell people often that I have a nurse in my back pocket. So when I don't know something, I have someone I can go to. My friend Mimi Vandenacker is a registered nurse, recently retired, and her area of expertise has been the gut, digestive health. She was the woman that for years was in the hospital, but in more recent years was on the phone talking to people prior to surgeries and things like that. And I know how frustrating it was for her to hear people suffering so much and knowing that she had a natural answer. She is a wealth of information, but beyond that, she has a huge heart and just desires so much to help people. So without further ado, Mimi, if you would like to unmute yourself and come on, we'd love to hear from you.
There we go. Can you hear me? Awesome.
Good.
Oh, thanks, Diane. That was sweet of you. Yeah, we have known each other for a while now. And when I don't know what you want me to talk about initially, but you want my story a bit, or do you?
Let's talk a little bit about what you have seen, Mimi, with so many people and the struggles that they have, maybe the medications that they have been given. And again, we are not anti-medication, but I know that because of your passion, you really see a better way, a different way, a more natural path that people can take. So maybe take that approach a little bit tonight.
Yeah, absolutely.
Okay.
Yeah, it has been a little bit of a frustration. I have been utilizing this protocol for now 3.5 years almost. And I've never felt so good. I mean, I had all the same signs and symptoms of insulin resistant that we all kind of see on those charts, right? And just to know that I was never taught about insulin resistance. I never heard that even mentioned in nursing school years ago. And here I was a GI nurse for, about a good 23, 24 years. And it's never talked about. I was kind of surprised once I started learning and reading about metabolic health and how it all fits together with chronic disease. And they all are linked together with insulin resistance at its root. Now, not that it's the only thing, but it is the main thing, is what I understand. And then you see the cascade of diseases and the cascade of medications people are put on. And granted, they have their timing and place when needed, but just to see how many medications people can be put on and the side effects, and then the meds to cover the side effects. And I think to myself, has anyone told you about dietary lifestyle changes? And most people are just clueless. And here I am talking to patients ongoing. And I was just surprised how little they really knew about, processed foods, carbohydrates, what they do to their systems, and how sugar is, like poison, actually, in a way. Food can be our medicine, but it can also be, toxic at certain levels, right? And we talk about high loads of sugar and how that is really driving the heart disease and the metabolic issues more than, let's say, fats or that kind of thing. So where was I going with that? I just wanted to say I've seen over the years more and more people with insulin resistance at a younger and younger age. Used to be people in their 50s or 60s or 70s, but now it's people in their 30s and 40s. And the gut health issues that they happen in teenage years, we have young people that just suffer from that gut dysbiosis that was just mentioned. And it's really sad to see that going on, and not being able to kind of say what you're thinking, right, about fiber, about dietary changes. You don't have time, and you don't have that's not your place to really talk to patients. So it's been a little bit of a frustration. And now that I have experienced it and I have done my research and reading, I realize how close I was to becoming probably a diabetic, to having more vascular issues. Obesity was creeping in, and I was just inflamed and was struggling with mental health issues and gut problems, and you name it. And just to see how fast I could reverse a lot of those things was very, very, eye-opening, to say the least. So, when I see the typical list of medications, high blood pressure, statin drugs, anti-anxiety and depression drugs, just autoimmune issues, right? Which are, a lot of them are gut-related issues, right? They stem from that leaky gut syndrome. And so, it's been eye-opening, to say the least. And I feel like this is where I'm being called, right? Here in my later years, was able to retire a little bit earlier than I thought. And now I have a new passion for helping people understand the process and have better choices and an option that's all natural. It really feels good.
Thank you so much, and we appreciate you and everything you do to help us. I was just on the phone with Mimi today because I had a customer who was having a little bit of a digestive issue, and I'm able to call on my nurse in my back pocket and get the answers that I need. So thank you so much for sharing, Mimi. Appreciate it.
Yeah, no problem.
All right, we have one more guest that we'd like to bring on, and this is a gentleman that I don't think I've met Bob in person yet. If I have, Bob, correct me, but I don't think we have. Bob, he was a PA for over 40 years, and I know that his passion is helping people. And I have a feeling that over the past 40 years, he's seen some big changes that have happened is regarding metabolic health. And so, Bob, if you are available, go ahead and unmute yourself and say something. Let me know that you're here.
I'm here.
Perfect. 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 So I would love to hear a little bit of your story because I know that you were a PA for over 40 years. And I believe when people go into that kind of a profession, it's because you genuinely want to assist people and to help them feel better. And I also know that you have mentioned recently that you never knew something like this existed. And it's been a blessing that you've been able to share this with so many people. So why don't you tell us a little bit about you and what you have seen transpire over the past 40 years?
Well, thank you, Diane and John. I appreciate the opportunity to share this. We got involved with this program partly because I developed high blood pressure. Barb and I had started a health food store 20 some years ago, and we practiced integrative medicine, both traditional and natural medicine. And I always considered myself a very healthy person. But I had developed a hernia, and it really wasn't bothering me, but we were going to go away for the winter. And so I decided I probably ought to have that fixed before we were in a foreign country where medicine might not be available. So when I went for my pre-op, my blood pressure was very high. And I was just kind of in shock about that. So I started looking around for natural solutions. Someone sent me an email and asked if I'd be interested in taking a look at something natural. And we've always been open to those things. So I said, sure. She sent me some information, and I looked at it. I thought, well, this really made some sense. I was aware of insulin resistance, but in traditional medicine and even in natural medicine, there is really not any direct solution. So in traditional medicine, we just treated symptoms, the symptoms that were caused by the dysbiosis and by insulin resistance. So we went away for the winter and we took 4 months worth of these products with us. And the acid reflux that I had and esophageal stricture was gone in 3 or 4 weeks. My blood pressure normalized very quickly in about 2 weeks. Chronic back pain that I had put up with since I was 20 has disappeared. Prostate issues better. And I began to see that this was something that many people could benefit from. Now, I've been a PA for 50 years and I had retired from the office. I still work with Amish folks, but I really miss the opportunity to help people with their health issues. And so we started to promote this and have helped quite a few people with weight issues and with sugar, and especially the mental aspect of things that Scott was talking about. And I began to delve into the research behind insulin resistance and how it caused inflammation in the arteries, how it created many of the hormonal issues that people are experiencing, and the gut issues. Most people don't know that the chemicals that are produced by the good, healthy bacteria in your gut are used by our body to make these neurotransmitters. Things like 70% of serotonin is manufactured in your gut. We were always taught that those things were made in your brain. And so Travis mentioned that a lot of these things are in traditional medicine are kind of outdated. People get their continuing medical education, but most of that's coming from the drug companies. And a lot of the foundational physiology is kind of ignored. So when I started 50 years ago, we actually treated high cholesterol with a fiber product. And then statins came along, and all of a sudden the fiber disappeared. And over the years, I've just seen people get bigger and develop more and more health issues. And we would chase the symptoms. We had medications to deal with all those symptoms. But a lot of the medications had side effects, and then you had to give them a medication to deal with the side effect. And polypharmacy, which is on a person on many medications, those people are just getting sicker and sicker. And what we're starting to see now is that with their doctor's assistance, many people are able to reduce their medications. I have some diabetics, type 1 diabetics, who have reduced their insulin considerably. Their sugars are more stable. Their A1Cs are much better. And then type 2 diabetics who are actually getting off of their insulin and off of many of their medication. So we certainly encourage people who want to reduce medicine that they do that with their doctor's assistance. And many doctors are very supportive. People say to me all the time, well, the doctor said, just keep doing what you're doing. And for many healthcare providers, it's a relief when somebody starts to take responsibility for their own health. We had a motto in our store, put your health in your own hands. And one of the things that I want people to think about is, where are you going to be in 15 or 20 years with your health? What you're doing today will determine what your future self will be like. And many of us have this image of us being in a nursing home in diapers and drooling on the tray. That's an image that we don't want to have. We want to have an image of, I read about somebody today who's 100 years old and still riding her motorcycle. people who are jumping out of airplanes when they're 90 years old. That's the way we want to end our lives. And it's important to understand what we do today determines what that future self is going to be. And I would highly encourage people to look at this and just give it a try. It has a money back guarantee. If you follow the protocol and document your use and it doesn't work for you, the company will give your money back. So it's a really win-win type of thing.
Awesome. Well, so such a blessing, Bob, to have you on here and your knowledge and also endorsing of this. I mean, that's a big deal. I mean, you've been helping people for 50 years, and it's just awesome to see that you still have that passion, and it definitely is inspiring. So thank you so much. So we got like 12 minutes left, and we're gonna use all 12 minutes for these folks on here. So I want a real quick question to each one. So Trav, Dr. Trav, sorry, that's what I call him outside of this call. But Dr. Trav, fasting in just a couple minutes, why is it so important? And why is the Unimate such an important tool to help us fast?
Great question. And the first thing I'll say is the myth about fasting. We need to break the myth. Fasting is not starvation. Fasting is simply restricting your eating into a smaller window. You could start with 12 hours and slowly build over time. But the idea is we don't want to eat several times throughout the day. We want to bring our blood glucose levels, our blood sugar levels down, which brings our blood insulin levels down. And when your insulin levels stay low, your body is able to convert from using carbohydrates as an energy source to using fat as an energy source. And that is where we want to get. So fasting is not starvation. We want to drop those insulin levels, and that can be done in a very healthy way. The beauty about the Unimate, the yerba mate extract that we have, the tea that we have, is with the chlorogenic acid and the drink's ability to allow our body to create and enhance its own GLP-1, you can do a couple things. You can fast better without that food noise, the cravings, and the hangriness that you get. And when your body creates that GLP-1, you can get into some of those more pronounced fat burning type of situations. And so the Unimate is a great drink. I use it as a performance drink. I don't know, I don't necessarily endorse it, but I use it when I work out. So I work out at 4:30 in the morning with my wife. I mix my Unimate with some lime juice and some ice, and that is my morning beverage that I drink for the next couple hours while we're working out and recovering, because it helps me start the day, keeps my hunger down, and allows me to fast until later in the morning and sometimes early afternoon.
Awesome. Thank you so much. We'll be having Dr. Trav on a lot more of these calls. Thank you, Trav. So Scott Harker,
Yes.
fiber. Is fiber just fiber? What is the difference? I mean, why don't they just go Benefiber, Metamucil? Why does this work so well? And what people don't realize, the rest of the world's been using this for 30 plus years. And what we haven't heard about it in the US. Why? But why is it so important, and what's it different?
Well, yeah. So I'm going to kind of explain balance a little bit and why it's important and a little bit breakdown. But the easiest way I would say to explain balance is to just basically start with fiber. That is so critical to how our gut works, right? We hear a lot about prebiotics and probiotics, and there's a prebiotic in this particular fiber, but most of the time, to just get our guts to work right, we need the right insoluble and soluble fibers. And think about insoluble fibers as bulk that moves, it gets movement through the digestive tract, right? And the soluble fiber interacts with water, forms more of a gel, and it can influence how the meal moves through the digestion and how nutrients is or absorb. And so this is what's really neat about this particular product is, and this is the fiber really helps us with those, right? And we don't just feed ourselves. We got to feed our guts, and that's what our gut feeds on, right? And gut microbiome ferments certain fibers and produces these things that I can't remember if it was Dr. Travis or Bob was talking, right? But it produces those short chain fatty acids and things like butyrate, and it's important fuel for our colon cells, right? And that also participates in helping us with our metabolic health. So when we have that fiber, right, and gets our gut healthy, there's such a tie-in between gut health and metabolic health that's so important, because without a healthy gut, I don't believe we lose weight, and I don't believe we really get to be where we become insulin sensitive, right? So when we eat carbs, they become glucose, right? And insulin helps move the glucose in the cells, like you talked about earlier, John, right? But this product not only, helps us move things through the system, but it also helps us with getting the sugar and keeping our glucose level down like 15 to 20 minutes after we eat, so we don't get those spikes. So fiber is so essential to our gut health, and it turns around, impacts our inflammation, our permeability tied to inflammation, our immune system, our mental health, all of those different things. And that's why balance in this protocol is so important, because of the fiber.
Awesome. Thank you so much. So, Bob, you and I'd like you and Mimi both to field this question. You work heavily in the Amish communities, and I think a lot of people think that, they're the healthiest people in the world. They're living off the land. They're cooking all natural. But what I've noticed when I've been to out west, all the way to the East Coast, north, south, it doesn't matter if you're young, old, black, white, Amish, English, does not matter. We're all dealing with the same stuff. But when you go into these houses, I mean, they're hurting. I mean, and I see it too. They're hurting. So, what have you really noticed, even in those communities, when you're in those houses? Mute. You're on mute.
Are you
There you
Do a
go.
lot of, I do a lot of house calls to the Amish, and their diets are terrible. They eat all of the baked goods, and they sell their baked goods, but they eat all of that stuff, and they make their own noodles, and they're very proud of that. But those are wheat noodles. They're starch. They're digested 100% to glucose. They eat a ton of ice cream. Um, they're always, having gatherings, church, funerals, weddings, and they party up, but they don't do alcohol. They just do a lot of sugar.
Mimi, if you can close this out real quick. You are traveled from Wisconsin to just all over the country, you and Ott, helping a lot of the communities. But what are some of the things that you've seen? I think it's probably going to be similar to Bob, but what are some of the things you see? What do you think some of the things are so eye-opening when you explain to them what our food does? And you can close it out here in about 2 minutes. We'll try to end 2 minutes early.
Yeah, that's a good question, because a lot of the men will kind of come to me and say, our wives, they cook a lot and it's tasty and really good, but what you're saying just doesn't make sense anymore, to just continue this way. So they see the problem. They love food, but starting to slowly get it. And I see them starting to ask more questions. And those who really want their lives to change, and they can be pretty desperate at times, they are willing to do. They are very hungry for information, and they are willing to learn. And they're very humble people. I find there's very few prideful people that are very anti-change. So I find that very intriguing and motivating. And I really want to help these people and help them just, slowly make these changes and really just spread that, things can be different, and they don't have healthcare insurance, right? They rely on each other for their medical bills. Really, it's a community that supports each other, right? And they can see now, wow, if we can help each other all get healthier, it's not only our lives here at stake, but it's our finances that really can be changed, because we won't have so many chronic illnesses and people on medications. So they're starting to really open their eyes to this. And I find that very heartwarming. I find that motivating. I want to help these people. And it's just sharing that one kitchen table to the next, right? And getting to know them. And so it's been a joy to do it. I know it's a lot of hard work. John, you can attest to that. But it's worthy, and these people need to heal too. And I find that we can do a lot of helping with this protocol, a lot of helping, and they're open to it. Yeah.
Yeah. Well, I want to thank you. I want to thank all of you for being on this call tonight. What a selfless act to come here and teach and explain. And we'll be seeing a lot more of these. So one last thing is, get back with the person that invited you on this call. Or maybe you're going to be watching a recording of this. We'll have that available for people to be able to have. But get back with the person that invited you on this call. They can get you more information. They can answer their questions. They can actually save you about an $80 discount by going through them. And like Bob said, there's a 90-day money back guarantee if you track it on the app that you truly took the protocol. And this is a pretty important decision. Everybody that invited you on here, they're trying to save your life. They're trying to make a difference. And we're going to do it one house at a time, one Zoom at a time, one video at a time. Everybody have a good night. And hopefully this was very beneficial. It was for me. And thank you, Dr. Travis, Scott, Mimi, and PA Bob. So have a great night. Thank you. Diane, great job co-hosting. Thank you so much.